Good morning, everybody. I hope you all slept well. I hope you all enjoyed the custom s'mores and whatever else was going on. The quality by design drink that we had put together is very, very clever. Great job for the marketing team. Very well done. So, as you can see, we're here to learn, but we're also here to have some fun. I'd like you to disregard the title of this talk. It's very generic. It actually doesn't mean anything. And as I was putting this talk together, I realized that what I really wanted to talk about today was data. We spent a lot of time talking about processes and technologies and systems, but at the heart of all this is data. And so, where does the data come from, right? Well, it comes from all the activities that we undertake as we prosecute a CMC program for the development of a new drug. And so this is a figure adapted from the Agene case study that Nimble put out recently. And at the top, you're seeing top swim lane are the three stages of process validation as defined by the FDA. At the bottom, are all the things that I'm familiar with, all the activities that you undertake, development activities, manufacturing campaigns, as you're learning about your process and scaling your process to get to the commercial scale. You're generating a lot of information as you run those activities, and the challenge has always been how to feed that into the middle layer, which is the control strategy framework, right? So process development, clinical manufacturing, control strategy framework, demonstrating process validation. This is what you're doing over the multiple years of activities, and this is where the data is coming from. Now, it sort of goes into this traditional tech stack, and I'm going to give John McGuire the credit here. He put this diagram together a number of years ago for us. We're still using it. Whoops. And so, this is the tech stack, the structure, the ISA 95 structure, level 1 systems, level 2, level 3, you're collecting. This is where all the data is feeding into historians and ELNs and LIMS and analytics. Level 4 has traditionally been quality management systems and ERP solutions. And then, of course, the chaos of managing requirements and risk and compliance and project and process management in Microsoft Office, right? This is where it sits. Emails, Word documents, PowerPoints, Excel spreadsheets. And so this is the traditional tech stack. And what we're seeing now is this evolution of the tech stack over the past few years, right? So now you're looking at IoT devices coming in, so you can start to stream data and actually see what's happening with your devices for monitoring and maintenance, or maybe to get data directly into your system. AI and ML solutions coming in to think about how to model and do predictive work around using your data. You're starting to see the convergence of historians and ELNs and LIMS and analytics into singular platforms as they come together. And of course, what we're doing at the top level, which is to try to unify all this information around product and process and requirements and your control strategy framework into a single environment so that it can be utilized and provide context to all that data and work that's happening down below. But there's some unintended consequences of all this data that we're generating, right? So this number, 0.5 to 10 petabytes, is the range that a small or medium manufacturing facility, this is the amount of data they generate per year. Now, to give you some context around that, the US Library of Congress, all the information in that institution is 1/4 of a petabyte. So one manufacturing facility is generating 2 to 40 times the data that's in the Library of Congress every year. 70% of that data is never used, right? So we're generating all this data, we're not using hardly any of it. This is numbers back from 2018, right? More broadly, 80% of data across all industry sectors is unstructured, right? So collecting data, like Dan said yesterday, dumping into data lakes, mud, right? That was the word, mud. And when it's unstructured, it doesn't get used. 1% of unstructured data is utilized, all right? So I'm going to take a little tangent here. I want to talk a little bit about the axioms of information theory. What's going on? We don't understand, like, why are we doing this, right? So the quality of a measurement or data is directly dependent on the information in the measurement. So there's no information in what you're measuring, it has very low quality. The information in a measurement is directly dependent on the uncertainty or the noise in the measurement. So if you have a lot of noise, it's masking your signal. Your signal-to-noise ratio is 1, useless measurement, right? The faster the generation and transmission of data, the higher the uncertainty or noise in the data. Starting to see where this is going, right? So there's a picture of a bucket brigade down there, trying to give you a little bit of an example. In the old days, if a building was on fire, you'd line up a bunch of people, somebody would be at the well, and you'd be passing buckets of water down, and at the end, they'd throw the bucket on the building, right? Now, if you're moving the bucket slowly, right, and you measure the mean level of the water in the bucket at the end, and the variability around that mean, the mean's going to be higher, the variability is going to be low, right? The faster you start moving the buckets through, more water sloshes around, spills out, the mean's lower, and the variability is higher. And so that's what that axiom is actually referring to, right? Now, the uncertainty in the data should be less than the system's capacity to resolve the uncertainty. What does that mean? So I'll give you an example. You're in a bar, a loud bar, talking to your friend, and your friend says something, and you only catch a couple words of what they said. Hey, Ryan, can you repeat that? So he repeats it, and I get a couple more words. Still didn't get all of it. Hey, Ryan, can you repeat that one more time? He says it the third time, now I got the message. I understand everything he said, right? What's the corollary in the lab to that? Averaging, right? You take n equals 1, a lot of uncertainty in that data. The more samples you take, you are averaging now, and you're resolving the uncertainty in the information, right? Okay. So the generation and accumulation of high volumes of data does not necessarily provide more information. If you put all these axioms together, that's what you're saying, right? You are generating vast amounts of data, but you don't have more information because of these scenarios, right? So what do we do with all this data, right? Well, you bring in the data scientists, right? Data scientists come marching in, right, like minions, right? They're in here. What are the first thing they do? Find ways to reduce the dimensionality of the data, right? So we run things like principal component analysis and singularity decomposition and all these algorithms, right, Kant? Right? That's what we do. Why? So we can extract information from it. We need to resolve the uncertainty. We need to figure out what are the actual elements of data that are meaningful in our analyses, meaningful to our end objectives, right? So first it's generate lots of data, throw it into a lake, then you come in and you got to go and sort through all of it to figure out what it actually means, what's important. So the question we ask is, can structure improve data quality? And our answer is yes, because if you think about it, creating a structured framework is a way of reducing dimensionality a priori, meaning before you start collecting the data. It's like a compression algorithm in a way, right? You are defining the dimensions that matter based on the end objectives of what you're doing ahead of time. And you start capturing data based on that lower set of important dimensions. And so you use prior knowledge, you use risk assessments, you look at regulatory requirements. These are the things that help you reduce both the dimensionality and the uncertainty, because these are the things that you know and you can use as reference points for the information that you're getting. Okay, another sidebar. The transition from paper maps to digital maps. We've seen this play out, right? Right in front of our eyes over the past 15, 20 years. So those of you who are old enough, when you're going to go on a trip, you pull out a paper map. All right, here's the route. Oh, by the way, what's the weather or traffic going to look like tomorrow? Well, let's check the news, let's check the radio. You'll get some sense of what's going to happen tomorrow, maybe. Get on the road and you start following signs, right? That's how you traveled. Today, pull out the phone. Siri or Google, tell me how to get to Hotel Zaza, right? And it pulls up the map, automated directions, time it's going to take, traffic, all that right there, right? It's integrated value. That's what the digital map provides today. How did they do this? Structured data, right? You had satellites roaming the Earth, creating raster maps, vector maps, roads, parcels, buildings, right? Then they layer on the GPS data, so you have locations. Then they layer on cell phone data, so you have traffic. That's how you start to put together data in an integrated way to see where you're going. Can we do this for pharma, biotech, CMC? Right? We have quality by design principles, we've got Pharma 4.0, we've got CASA, all the things we want to do, yet we're still stuck in documents and spreadsheets and Microsoft Project and you name it, Gantt charts galore, right? So what's the future look like? The future is digital CMC. It's what we're all talking about, right? Today and yesterday. By the way, that was a fantastic keynote yesterday, Dan. Everybody's raving about your talk. So what is digital CMC? We have a definition. Our definition is a structured framework for the aggregation, organization, and governance of CMC data, workflows, and processes. And the goal here is to dramatically improve management, utilization, and integrity to get these therapies to patients a lot faster. We also think that, so the question is, okay, if it's structured, what should the structure be? Like, what should be the principles of the structure that are flexible enough to accommodate all the different ways that we do things, right, but still provide the utility that you need? And so we've been talking a lot about the idea of a FAIR structure. FAIR is, findable, accessible, interoperable, reusable. How easily can you find this information? Can you access it when you can find it? How well does it work with other systems? And ultimately, can you templatize it to reuse it, especially if you've got platform processes? What are some of the key properties, right, when you think about FAIR? And I highlighted in red, I think, what are some of the key terms that matter for us, right? It's rich metadata, data and metadata that's indexed and searchable, right? And that's a bit of a challenge with the data lakes, right? It's all dumped into the data lakes, but it's not indexed, and you got to have people come in. Your army of data scientists have to come in and figure out how to mine it, what to do with it, right? How to tag it, label it, whatever, right? Should be easily retrievable. Again, applicable language for knowledge representation. Include qualified references to other metadata. Metadata are richly described with relevant attributes, detailed provenance, and domain-relevant standards. ICH, quality by design, GXP, right? These are the things that matter in our world, right, from a domain-relevant perspective. So, first step, got to get things out of documents, right? Get it out of the documents. Move to data-centric modalities. Get it out of docs and PDFs and Excels. Start to break it apart into what we call atomic data, categorized by assets. The things that we know, assets, variables, unit operations, material attributes, quality attributes, right? These are the things that we know and think about, and that's the language that we talk, and it's the language that the regulators are expecting when you're talking to them about what you're doing, right? Once you've atomized the data, now you can start to link it together, right? So now data can describe other data, right? This is the idea of data being described richly by other metadata. Now you have a structured data set, right? You have a bunch of atomic pieces of data, all richly labeled, all linked together. Now they're fully addressable, right? Fully addressable piece of information, and you can start to pull on any kind of thread that you want to resolve a question. You know, what's one of your critical quality attributes? Oh, it's this. What's the method for it? Oh, this is the method we use to measure it, right? What's the specification? Oh, that's over here. It's linked, right? What was the evolution of that specification? Oh, let's trace it back in time because we have detailed provenance, right? So when you have this highly dimensional structured data set, it's already labeled, it's a form of a data lake, but the dimensionality is constrained, and you already have it framed in a way that you can use it right away. Next, embed the workflows that we know, right? Risk plans, setting up your project, TPPs, QTPPs, performing a risk assessment to get to CQAs. This is that CMC playbook that I showed in the first slide, right? And so you have structure, you've got the workflows, and now you start to see how this is going to come together to provide context to all the information that you're generating in a way that you have a lot less uncertainty about that data and therefore more information captured within that data. So how does this integration come together, right? I was talking a little bit about pulling on threads. Let's look at ICHQ8, right? That's a domain-relevant standard that says, well, pharmaceutical development at a minimum should include defining a quality target product profile. As we've been talking to a lot of CDMOs lately, they tell us how amazing it is that when companies come to them and say, hey, we're ready to run our PPQ batches, and they say, okay, can you show us your QTPP? And they just kind of stare at them. What do you mean? You know, your QTPP. Yeah, we haven't put that together yet. Oh, then you're probably not ready to run your PPQ batches. No, let's go ahead and run them. It'll be fine. Okay. Of course, it's not fine, right? Everything fails, and then everybody's wondering what happened. Identifying potential critical quality attributes of the drug product. Selecting an appropriate manufacturing process. Defining a control strategy. And then an enhanced QBD approach is to identify the material attributes and process parameters that can have an effect on product CQAs. Now, this is interesting because I think the most recent guidances that I've been reading from the FDA, especially on the cell and gene therapy side, are starting to mandate that earlier, right? They're starting to say, we're asking for that earlier at the IND stage, and if you don't give that to us, you're probably going to end up on a clinical hold. Not fun, right? So, rich metadata, CQA example, right? You see a list of CQAs in a digital format. Then for a particular CQA, you're drilling down. You can see all the different types of information you can capture. You should capture, right? But all structured. General information, doing a criticality assessment, understanding the acceptance criteria and its evolution, understanding process capability, so being able to link to other data sources that say, oh yeah, here's the batches we ran, or here's the experiments we ran, to demonstrate that we are not only meeting specification, but that the capability of our process is strong enough that we can be Six Sigma or wherever we need to be once we get to commercial. Right? Then digging in deeper, more layers of information, all still structured, all still relevant based on what the best practices are asking you to do and what the regulatory authorities are looking for as well. Process knowledge maps. So now you have structured data set that's well connected, right? And you can move past, the challenges of fishbone diagrams. What an awful construct, right? We've been using forever, right? Sort of generalized traceability. Okay, this group can kind of affects this down here, but you don't have any real information, right? You still have to pull in all the subject matter experts to figure out what does this fishbone mean and what are we actually going to do with it, right? So now you're, selecting an appropriate manufacturing process. Well, you need to be able to define a manufacturing process first. And it should obviously be risk-based, right? That's what the agencies are looking for now, right? So let's make that definition happen in a defined structure, and now you can create new visualizations. You can create knowledge maps, right, based on this construct, which gives you a lot more information, right? Color code things by risk. Size of objects tells you importance, right? Start to filter to see traceability. So that's what we do here, right? The enhanced QBD approach was tracing. You should be able to show how critical material attributes or process parameters affect your CQAs, right? Now, we ask people all the time, well, how do you do that right now? You get two answers. A, either they don't, or B, they sit down at some point and manually draw these maps and put them together, right? So neither one is particularly, I think, satisfactory, but these kind of constructs allow you to automate the things that are already defined in the ICH guidelines. Adding more layers, right? So we're talking about the digital maps, right? You had GPS, you had a cell phone to get traffic. Well, these kind of constructs that are structured and layered allow you to start building these same kind of layers, right? So before we were looking at traceability of parameters to attributes. Now we're still looking at that, but now we've layered in more information. A control strategy map, right? And you can continue on because that's the structure. That structure allows you to basically build your own Lego house. However you want to put those Legos together, you can start to piece that information together in a way that's relevant and meaningful to you and your program. So structured data is something that can really drive data quality, right? Because it's dealing with those challenges of information theory, right? And it's not to say that you don't still need to capture data. Sometimes, from a scientific perspective, you may not know which variables are impacting, which inputs are impacting which outputs, right? And so then you have to capture some of that data and then run through those analyses to figure out which are the actual variables that matter, right? But that shouldn't be the process for everything. And so as you structure data to drive data quality, you can do things like risk-based data-driven development. You can start to build robust digital control strategies. You can think about digital tech transfer and facility fit. You can start to automate the drafting of regulatory submissions. You can think about integrating with MES solutions because you're capturing in a structured format, again, a priori, a lot of the information that will feed into the MES, right? One of the things that we hear is, and I'm sure you've heard it too, is that it's time to implement the MES, and you sort of get a subset of the information you need. It's not complete, don't understand, why was this chosen, what happened here, and now you have to kind of sit down and figure all that out. So another point in time in that cycle where everything slows down, right? Slows down there, slows down at tech transfer, it slows down when it's time to draft the regulatory submission. We constantly end up running and then hitting a wall and stopping because we have to go find the information to feed the next stage of the process. So it's important to respect the data from our perspective, and it starts with structuring it. Structuring it can drive data quality in two ways. From a quantitative perspective, as we talked about, you can reduce dimensionality, you can reduce the uncertainty, and you start to really pull out the information and intelligence you need to drive digital transformation successfully. From the qualitative perspective, right, you build a data culture around structuring your data, right? And then that drives data governance, and then that drives data integrity, which is the other side of the coin for successful digital transformation. You can't get to the end without both sides of the coin. And we're going to hear later today about some of these topics, which I think is going to be further illuminating this conversation. And so it's important, we think, to think about this in terms of how you're going to structure data going forward.